It's a topic that many men are uncomfortable talking about, even with their doctor. Yet, urinary tract discomfort can often be a sign of more serious problems, ranging from easily treatable infections to life-threatening conditions, including prostate cancer. We spoke with Dr. Martin Weissman, a urologist with St. Joseph Hospital in Orange, who explains more on this important topic.
In the last 14 years, we've had a dramatic increase in the incidence of prostate cancer in doctors' offices because of a couple of legs of a tripod, namely the PSA blood test, the ultrasound and biopsy that we can now do in the office, and also the ability to get a biopsy with a particular instrument called a biopsy needle, which allows us to get good pieces quickly. How should you actually be diligent in looking after your prostate health with regard to prostate cancer? The answer to that question is dependent a little bit about your history. For example, if you happen to be of the black race, or if you have a family history of prostate cancer, you should start being diligent at age 40. That's the current recommendations of the American Urologic Association. At the age of 40, you would then start having an annual rectal exam and a PSA test. If you're not in any of those higher risk categories, the current recommendations is to start at age 50 with an annual rectal and a PSA. Things are in flux, and there is a movement afoot to begin the entire screening process earlier, because there's evidence that men in the 20s and 30s already have the first glimmer of prostate cancer. It's a very slow-growing process in the first few years of the process, meaning that one cell goes to two cells might take 4 to 5 years in the beginning. By the time the cancer is already making a lump in your prostate that we can find and is easy to feel, the prostate is already experiencing a more rapid cancer division, maybe down to 3 years. After it becomes more aggressive, the division may go to a doubling time of 1 to 2 years. At that point, it's a little bit late. So become intelligent, start early, make some decisions about how you want to be followed, learn as much as you can. There's been some evidence that if you look after your heart, you're going to look after your prostate. What that really means is that there are nutritional aspects of heart care that may impact on prostate care. So become intelligent both about the things for your heart as well as your prostate. These are things like certain vitamins that are of value, like vitamin E, not having a high-fat diet. There's good evidence that this is of value for the heart, and it's also evidence that it may be of value for the prostate. There's another major area that has been directed at the prostate, but maybe a bigger area than just the prostate, and that's a category that's now being called chronic pelvic pain syndrome of men. It has some similarities to a condition that has become well known in women, namely interstitial cystitis. This category was originally categorized as infection of the prostate. So there are a lot of men walking around with the diagnosis of chronic prostatitis, implying infection and being treated with antibiotics over and over and over again, with some effect in some and not much effect in others. What we've discovered is that not all prostate inflammatory conditions are due to infection. There is a definition of this that has been created by the National Institutes of Health. So once again, people can go online, type in chronic prostatitis, and learn a lot. But where this information is taking us is looking at symptoms in the pelvis and not calling everything chronic bacterial prostatitis. If we make a proper diagnosis, we can offer proper therapy. Antibiotics is not always proper therapy, and so therefore it is very important to be very discriminating and analytical and intelligent when you have symptoms in the lower urinary system and not call everything prostatitis. For example, interstitial cystitis, which is present in a larger number of women than we ever suspected when it was originally placed on the map in the early 80s, is a condition that is now being recognized increasingly in men. As a matter of fact, the condition may not be adequately named when it's named interstitial cystitis. It may be actually a mucosal barrier dysfunction. There's a lining to the mucous membrane in the bladder, just as there is in the mouth and in the intestines, and this lining may be defective. If it is defective, then there are substances that are in the urine which may get into the bladder wall and cause bladder irritation. That leads to pain. So this is a sequence that is becoming better understood, but is still not clear. It is still controversial. There's way more that one can do about this. There are herbs, there are medications, there are a variety of other treatments. It is not just antibiotic.